Okay, so I'm going ahead and demonstrate the injection checkoff that we have. So right now I'm currently sitting at the Pyxis. If it were adjustable height, I'd bring it to the appropriate height. While I'm looking at my patient's chart, however, it says that patient S will be getting Humulin NPH, Humulin regular, and an antibiotic ceftriaxone. So according to that, he's going to get 15 units of NPH, 13 units of regular, and 750 milligrams of, which is 0.5 milliliters. So in order to do that, I'm going to grab my insulin and the antibiotic. I'm going to make sure that this is NPH, Humulin regular. I'm going to check to make sure that the ceftriaxone along with the others are not expired or anything like that. Perfect. And since my patient's blood pressure was about 180, it's okay to go ahead and pass that. And then due to the dog bite wound, that he has, we're gonna go ahead and treat it with the antibiotic ceftriaxone. So I'm gonna wash my hands, I'm gonna gather my supplies, and I'm gonna head into the room. Hi, my name's Thomas. I'll be your nurse today. We got a couple of things we're gonna get done today. We have 2 injections. One's insulin to monitor and control your blood sugar, and the other one is ceftriaxone, which is an antibiotic used to treat the dog bite wound that you have. So can you go ahead and state your name and date of birth? Perfect. I'm gonna make sure that matches the name and date of birth on his wristband. So do you have any questions or anything like that? Because I want to kind of walk you through it. Nope. Any known allergies? No. Okay. So like I said, you're gonna have 2 shots today. The first one is the insulin, the NPH and the regular. It's gonna go into your abdominal area, and it's gonna be about 2 inches away from the umbilicus or 2 inches away from any wound. And then the second one is going to be the antibiotic, the ceftriaxone, which is gonna go into your deltoid. You're gonna find the acromion process. You're gonna go 2 fingers down, and that's gonna be the site of that injection. The ceftriaxone is IM, intramuscular, and then the insulin will be sub-Q. So do you have any preference on which one you'd like to do first?
Insulin.
Insulin? Perfect. We'll go ahead and go with the insulin first. So I'm going to open this up. I'll wipe down the NPH. I'll wipe down the regular. Put this here. Grab my syringe. First, I'm going to check and see. It looks like it's 15 units of NPH. So I'm going to pull down 15 units of air. And I'm going to inject that into the cloudy. Then it says 13 units of R, so I'm going to pull down 13 units of air and inject that into the R. Once I do that, I'm going to flip this upside down, and I'm going to pull out 13 units of insulin regular. And I'm going to, because it's a high alert drug, I'm going to check this with the nurse in my room.
Looks good.
Perfect. Then from there, I'm going to go to the NPH. And I'm again, on this, however, I'm going to pull out 15 units. Similar to the regular, I'm going to double check with the nurse in the room, no bubbles or anything.
That's 28 total, correct?
Yep.
Good.
Perfect. So then from here, I'm going to scoop this cap, put that in there. I'm going to clean the patient. And as I mentioned, this is going to go in your abdominal area. It's going to be about 2 inches away from the umbilicus or 2 inches away from any wound. So I'm going to pull this out. I'm going to pinch an inch, and because this patient is within range, you can go ahead and give the injection at a 90-degree angle. Here. And inject all the insulin. Perfect. I'm going to scoop, cap that. I don't want to rub the area because that may cause a hematoma, but other than that, they may have a little bleeding. I could blot it, and then if they're experiencing any signs or symptoms of hypoglycemia, to be sure to let me know immediately. Okay, so I'm going to set this over here. Then I'm gonna go ahead and grab the ceftriaxone. I'm gonna grab my 3 milliliter vial, and I'm gonna grab the blunt needle. So here it says my patient is getting 750 milligrams of ceftriaxone, which is equivalent to 0.5 milliliters. So first, I'm gonna attach this to the blunt needle. Set that down here. I'm gonna clean the top of this. And then I'm going to engage the blunt needle into here. First, I'm going to take 5.5 milliliters of air. Then I'm going to put it in here. I'm going to inject the 0.5 milliliters of air, and I'm going to turn it upside down, and I'm going to pull 5 milliliters. Since there's a couple bubbles, I'm going to make sure that it's even out. And then I'm going to double check, scoop this first, and then I'm going to double check with the other nurse in the room.
Looks good.
Perfect. So then from there, I'm going to detach the blunt needle, and I'm going to attach then the actual needle. Set this down. I'm gonna go ahead and clean this up. Like I said, so he's getting 0.5 milliliters. This is going into the arm. You're gonna find the acromion process. You're gonna go 2 fingers down, and that's where the site's going to be. So I'm gonna go ahead and pull this. So using the Z-track method, I'm gonna make sure I pull the skin to the side like this, and I'm gonna go in at 90 degrees, and I'm gonna insert all the antibiotic ceftriaxone. I'm gonna pull this out. So there may be some, I'm gonna scoop. I would put the safety on just to be precautious, and to use this again, I'm gonna go ahead and just put the cap back on. Set this over here. And at that area, you may experience some tenderness, some soreness. This antibiotic also may have some side effects of GI upset, so be sure to let us know if there's anything like that that occurs. So once we're all done, I'm gonna go ahead and clean up all my stuff. I'm going to put the bed to its actual position. Like I said, my bench isn't moving, so it's unadjustable, but I would do so accordingly. I would ask the patient if they needed anything to report any signs or symptoms immediately, and any change in vital signs. I will put the call light close by, and then I'll be back in like 10 to 15 minutes. Once I'm cleaning up everything, I'm gonna wash my hands, I'm gonna go out, and I'm gonna document. Thank you.